Dr. Jaffe, can you help us understand blood spot testing for delayed immune response? Does it have the ability to accurately measure immune response? Why or why not?
Well, the blood spot system says that we can take a drop of blood, put it on a filter paper, send it off to the lab, and measure something. And you can do that. In fact, with fluorescent technology that has a variance of 15% or more, which is too high for my clinical preference, you can look for antibodies like IgG on a blood spot. And it has the advantage that the person can just come by at any time, have a little drop of blood taken, put on the filter paper, sent off to the lab, and you get results. And then you say to the lab, well, gosh, I know that T cells are kind of important in immune defense and repair process. Did you measure T cells? Oh, no, because that requires a cell culture. This is just a blood spot, a dry blood sample, and we can find antibodies. We just can't tell you whether they're helpful or harmful. And then there are some companies that have done their best to make the blood spot more specific so that they can avoid many of the false positives and give you a more accurate IgG measurement. But by definition, you miss the T cells, and frankly, you did not directly observe what was going on in the immune system. So it has the advantage of being quick and dirty. Quick in the sense that you don't need any special preparation because you're not doing a cell culture. You're not going to get T cell information. And you're only indirectly going to get information about B cells, and you won't be able to tell whether the information, the antibody is a helpful, neutralizing, beneficial antibody, or a harmful, complement fixing, troublesome antibody. So there's lots of reasons why blood spots are favorable to those who don't know what's really going on and they just want a quick and dirty response from a laboratory. We developed the LRA by ELISA ACT test because we knew decades ago how important the T cells were and how important it was to distinguish helpful from harmful antibodies and how important it is to get immune complexes all in one specimen. And that's why we recommend the LRA by ELISA ACT test and why we do not recommend blood spot tests, because they're, shall I say, spotty.